Yeah, so I'm Mark. This is one of my partners, John. We're two of the founders for Solve Clinics. It started in 2017, our company. It's initially a hair transplant clinic and hair restoration with preventative treatments as well, and has evolved really into the cosmetic space. Most recently, opening of a second office that is in River North in Chicago. So it's on Erie near Clark Street, which is by the Carryman Tavern. But with that expansion, we added another physician associate who is Kelly Pfeiffer. She was hoping to be here today, but she did have a family commitment come up that prevented her from joining. So in
She
her
did want to say she's very sorry to miss, and if anyone has any questions, she would love to talk to people. It was kind of an unexpected family issue, so
Yeah.
but she really did want to be here.
Yeah, she's a newer addition to our team with the River North location opening and adding a lot of the cosmetic side. So injectables, expanding on the laser treatments that we can offer, a lot of things that we'll talk about today, that John will have the privilege of talking about since he's one of our founders, but a physician associate as well. But he'll step into that, and without Kelly here, you know, we'll miss a little bit. She's a big personality. She's great, but like John said, she's happy to talk to anyone if there are follow-up questions. You know,
More specific questions for yourself.
Yeah.
You know, we'll be kind of talking in somewhat general terms. Obviously, we can talk to people individually, but she is kind of the expert in terms of treatment plans, kind of talking through exactly what you're looking for. So if anyone has kind of any specific questions, we can always set up time to
Yeah.
talk about that.
Is she in both offices or just downtown?
She is
mainly it's just downtown.
She does come to Skokie like literally one day a month. So you know, it's pretty limited when she's in Skokie. But you know, that we could also set up a special day for her to come to Skokie. If there is, you know, a lot of interest and
Yeah.
people, and it's a lot easier to get to Skokie than downtown. You know, that's something we could definitely do, but she is mostly downtown.
And you do all procedures in both locations or?
So the question is all procedures at both locations? Generally, we actually don't. So hair transplants, which we will talk about, are pretty much exclusively at the Skokie, our original location. And she mostly exclusively works out of the River North location. So that will be injectables and laser treatments. Outside of that, we do offer preventative hair treatments. There's wellness and weight loss. There are other types of facials that could be micro needles, you know, vampire facials, they've kind of been labeled. Those are at both locations. So there is some
And even the
overlap.
injectables, because it's stuff she can kind of bring between offices. She can do in either location.
Yeah.
The laser treatments we'll talk about, it's a big machine and that one's downtown. So that one we can't really move, you know, location to location.
Yeah.
And then the surgeries obviously has a lot of equipment, so that's all in Skokie.
Okay, thank you.
Yeah, no, great questions. Any questions online before we get started? You guys don't know what we're here to present on fully, so it might make sense. It might make sense to jump in, and obviously, it's gonna be pretty open forum. So we're just gonna talk about the different treatments that we offer. And if you guys have questions, feel free to raise your hand or interrupt us. If anyone sees someone trying to get our attention, you know, feel free to interrupt us.
Bobby, you have a question?
I have a question.
Perfect.
I have been wearing hair pieces for about 30 years. I have, I don't know, whatever, female pattern baldness. And I either wear a wig or I tape it on. I used to glue it on, but they couldn't get the glue anymore because it came from China and they stopped selling it. Anyway, so now I'm sort of stuck with tape and I'm not real thrilled. I would love to have real hair, but if you do what you do, then I would have to go around with no hair for a few days or a week or what?
So yes, as it is kind of one of the unfortunate parts of the transplant, as you two know.
You might ask me after you finish.
Yeah, exactly. We do have to kind of shave the head.
Well, I already do that to get the
so
piece on.
and you can wear wigs, any kind of hair coverings. pretty soon after. Now, obviously, it's gonna take a long time for it to kind of grow back, especially if it's any significant length. But you can cover it with wigs,
Scarves, hats.
hats, like anything, any kind of covering, so.
For how long?
Yes.
I have a testimonial.
Let's hear it.
So 3 months ago, I was at Solve Clinic. Chrissy recommended them. So I had hair transplants.
I can barely hear you.
Oh, okay.
Move to the microphone.
Is the microphone on the camera?
Yes.
No.
No, it's up there.
It's up high.
Bobby, can you hear me now?
Better. I mean, it's not real great.
You know, it's.
So, 3 months ago, I had hair transplants at Solve Clinic. They couldn't take as many as they wanted to, or I wanted them to. So it was a little bit limited, but you can see my hair is short. This is what happens.
Yeah.
However, as soon as I could put something on my head, a few days after, I started wearing scarves and head coverings. And my office manager, she said, well, let's see what it looks like without. So I took it off and she says, that looks good. And I'm like, really? And she goes, yeah, you don't need to wear anything. And I'm like, I'll give that a try. And believe it or not, I get compliments on having short hair often, like every other day. From women, they think it's very chic. It's the truth. When I had long hair, no one complimented my hair. Seriously, that's why I went to you guys. But
So maybe no one even needs a hair transplant, just shaving your head.
no, it was, because it was bald before.
Yeah.
So anyway, the point being, you can look good with very short hair. It's very stylish.
Yeah.
Yeah, and Bobby, when you first met me, I had just had a transplant and I was wearing wigs to Chi chapter meetings.
Bobby, to answer your question, it's about 1 week where you're healing and there's scabs that you have to avoid, scraping. So wigs, glue, those types of things you'll have to avoid for 1 week after the transplant. But, your hair will be shaved. So,
All of it.
another consideration for some other people, maybe.
The whole head will be shaved.
Yeah, the recommendation, the back and sides have to be shaved. That's where the transplant is taken from.
Oh, that's right.
On the top, it's possible to leave it long. But again, the recommendation really is to just shave it. Really, it's a better look. You kind of have this bowl mushroom cut where it's shaved on the bottom and you can leave it long on the top. We really strongly recommend against it, not just because most people that do that end up shaving their head afterwards because it looks pretty ridiculous, but also means you have to kind of go through your long hair for ourselves and our staff and our team. It makes the surgery much more difficult to be able to find all the appropriate, locations that, the transplanted hair might, be placed in.
The big risk with leaving it long too is obviously we're placing, if there's hair up there and we're kind of coming through and placing grafts up near the longer hair, during kind of those initial healing phases, the long hair can actually get stuck on the grafts that we implant and pull them out. So
You go back to a more fundamental starting.
yes,
Yeah.
yes.
Yeah,
We kind of jumped
We
into.
jumped into some questions, so why don't we just open up the presentation? And I can, it's very informal. It is a boring PowerPoint, but mostly it's gonna be, what I'm sharing and have to say.
Okay, say something first.
Yeah, of course.
Bobby,
Hmm.
many PC speakers are not good. So if turning up the volume does not help you, if you even have a headset, you might
No,
hear
I
a lot.
turned it up. I made my volume louder and I can hear
Okay.
better now.
Okay,
Okay,
but just another
perfect.
thought. Sometimes a headset will make it easy for
I
people to hear
Can't
you.
do that with
Okay.
my phone. I can't do it with my computer.
Okay.
Sorry.
Right. So yeah, so we are at Solve Clinics. We kind of told our story a little bit. We have 2 locations now, but we'll just jump into some of the material. So the agenda for today are really just, you know, some of the treatment offerings that we have, and we'll talk about them a little bit. Happy to answer questions as they either come up or at the end, kind of circle back. But it's kind of broken up into, you know, almost two sections, similar to our business. There is this hair loss and hair preventative side, and then this cosmetic, you know, med spa that we've kind of evolved into and grown into since we started back in 2017. So we'll start just with some of the hair. You know, the transplant is kind of, you know, a standalone treatment of itself. It's kind of, you know, the only way to restore hair that you've lost. So through that balding process, the hair follicles themselves, you know, do go from, you know, healthy 15-year-old hair to when they've balded, you know, the follicle itself has died. So, you know, second to this is kind of a PRP treatment. It's a much larger category that's really preventative care. So about taking hair that might be thinning on the path of, you know, the balding, you know, the spectrum of a healthy hair through the different stages to the, you know, the ultimate, you know, balding, the follicle dying itself. But there are a whole number of preventative treatments that we'll brush on briefly, and they all work in, you know, quite a few different ways. Separately is the cosmetic side. So John, my partner here, will get into some of those. I'll start by talking about, you know, the hair side, but Ativa Skin Tightening is a very new device. We'll talk about that and kind of its benefits, you know, potentially for the face, the jawline and neck. It can be on the arms, the stomach, the legs and thighs. Something brand new that uses radio frequencies basically to tighten skin and you know, reduce elasticity. Halo and BBL are two different types of laser treatments. We'll get into those. Botox are injections. Filler and PRF are very different types of injections. They work in different ways and for different purposes. And we'll kind of finish with a summary of, you know, 3, 4, 5 other just one-off treatments that we offer. So we'll just kind of dive in. But FUE hair transplants, we've spoken about it briefly now, but the idea is that, you know, if you're in the balding process, like I mentioned, the only way to permanently restore hair is to do a transplant, to take, for the FUE process, individual follicles, so one at a time from the back and sides of the head, and place them on the top, which is typically, you know, where most loss occurs. With hair loss, there are many different types. There's male or female pattern baldness. There can be universal hair loss where you just see a thinning or diffusion all throughout the scalp. It could be the top, the sides, the back. There's alopecia areata, is an autoimmune disorder where overactivity of the autoimmune system suppresses hair, and it shows up in little circles and patches, comes and goes, it expands and shrinks. You know, there's scarring alopecia, so where the skin is basically the problem. Again, kind of an autoimmune overreaction. A lot of times steroid injections, you know, are used to treat those. So there are scenarios where a hair transplant is appropriate for hair loss, and there are scenarios where a hair transplant is not appropriate for hair loss. But, you know, assuming that, you know, that's what we're going forward with is a hair transplant. The idea is that we take millimeter in diameter hollow tip punches and core out around individual hair follicles from the back and sides of the head, and then make individual millimeter size incisions to then place those hair follicles back in. They heal and grow like they never left the back and sides, and it's taken from the back and sides again because traditionally, those are the hairs that are more resistant to the mechanisms that cause thinning and balding. So while maybe you've taken, or while maybe you've lost hair on the top of your head, a very common question is, well, if I take hair from somewhere else and place it there, won't that hair just fall out? But the idea is that the seed is bad, not the soil. Okay, so what that means, again, if we take something that's healthy from the back and sides and place it up top, it will heal and grow long term. It's not the top, it's not the scalp that's the problem. It was the individual hair follicle itself on the top that started thinning and eventually dying. Okay,
And the hairs actually around the sides and back are genetically different. So it's why, you know, you can place the hairs up top and they don't fall out. They actually have a different genetic makeup. So, you know, someone who's totally shiny bald up top, a lot of times they'll keep the hair around the sides and the back, because it is a different type of hair.
Yeah.
And genetically, the genetic makeup of the hair is different, which is why it works in the first place. But yeah, just kind of one of those weird things.
yeah, it's probably our most complicated procedure in terms of when we have consultations, people have the most questions. When you go in, you know, some of the other offerings here, you know, like Botox, people are very familiar with Botox. We'll talk about it here in a little bit. But a transplant, you know, there is a major timeline to it. It's a surgical procedure. There's healing. There's, you know, post-care, what do you do? And then there's this entire separate preventative side. So, you know, a good portion of our, you know, conversation here and presentation today is going to be on the hair. But again, we'll get through it pretty quickly to make sure that we have time, you know, for the rest of the stuff as well. So, a very typical question for hair transplants is the healing process as well. So like we mentioned with one of the questions that came up about wearing a wig after, it takes about a week where it's most obvious. You know, hollow tip core punches from the back and sides, sites that are created on top and hair follicles that are placed in for healing and growing long term. It's about a week of scabbing. So that's kind of where, you know, the most important stage of the post-care is all within this first week, where the transplanted hair follicles are basically most vulnerable. While those scabs are there, you know, bumping, scratching, if the follicle itself and the fatty tissue with the stem cells that grows the hair, if those are physically removed, if they're scraped or bumped or pop out, they won't be there to heal and grow long term. But 1 week later, we basically say, you know, while you touch it very, you know, very minimally, you clean it in a very specific and gentle way. 1 week later is when you can shampoo and conditioner and scrub and massage with your fingertips and knock those scabs off that have been kind of clustered up there for that first week period.
So it is pretty unsightly for the first week. It says, I don't know how it was for you guys.
I worked from home.
Yeah, that's what we recommend is, you know, if you can cover it, hide it, because that first week, I mean, it's kind of bloody scabs up top and you really can't kind of rub them off for that first week.
Yeah.
So it is,
I wore a hat.
Yeah.
Yeah, you have a hat that goes low enough on the brim so it protects.
Yep.
It doesn't interfere with,
yeah,
and I just.
you wore that all week.
Chrissy's describing that she wore a hat. We do send everyone home with either a hat or a scarf. And basically the idea is that the structure of the hat, pressure points are on your forehead. They prop up and over anything that's done in the front or really the back. And it, you know, it's very simple to if you need to go outside, you can pop it on and basically disguise most of what's been done. The donor area actually heals very quickly. I would say by day 3, typically, just by, you know, wetting your hair, which there's a very, you know, soft and simple way of cleaning that avoids any touching or anything like that. But by the 3rd day, just sleeping on your pillow, a lot of the hairs or scabs, sorry, from the back and sides where the hair was taken, those start falling off. So even wearing a hat from behind, you know, it doesn't look like much has been done a couple days later. Okay.
One surgery?
Do you have a picture of a hat?
Yeah, and I can kind of cycle through these now.
And that's a great question for a number of surgeries, and we can kind of see in the picture. So it is a little bit different for everyone. You know, some people just kind of have loss right in the hairline. Some people have loss kind of all over, you know, hairline, crown. Some people want to drop their hairline really low down. So part of it is always going to be kind of a supply and demand issue. You know, the more loss you have up top, because there is more hair up top than kind of around the sides and the back. So, and we can't take every hair from around the sides and the back.
Yeah, but you're talking about men.
Oh, well, yeah, men, women, I mean,
I
really.
know it's different for women.
For female pattern loss, you're right, absolutely is different. Classically, absolutely
Yeah,
is
the
different.
surgery itself is exactly the same. So plenty of women, you know, men and women do come in and have the procedures done for different reasons. Um, but yeah, the surgery itself, the recovery, the healing, you know, in terms of everything there, it's exactly the same.
But you're right, classically female pattern loss is not receding at the hairline like male pattern loss. It's kind of diffuse loss where you keep kind of the hairline and a lot of the hair kind of all the way back,
Chrissy,
but
your-
it just
your
kind of
feature.
thins out.
It's kind of thins
Oh.
out, right?
Yeah. kind
So
of the-
this is a great example, and Chrissy was great to work with us. She was happy to volunteer her pictures and kind of show, you know, a general timeline. So we mentioned the first week is the scabbing process, but it takes a full 12 months and kind of a different timeline of healing and then maturing where you ultimately get final results. So it's kind of just, you know, face on versus the top. They're a little bit different in terms of timeline, but the top one, I kind of wanted to show the actual surgery itself. So you can see, you know, in the second picture there on the right side, that's what it looks like leaving the very first day. It does scab over, but a week later, those are kind of gone, and you can kind of see the timeline, you know, at the bottom of each of those side-by-side pictures.
Is the upper right example one of loss at the hairline and the crown?
So
It
that's,
is. So-
that's a good point. And
Yes,
so this was a procedure where you can see kind of we focused more graphs up here in the front here. I don't know if you guys can see that. And then we did put some through the crown. So you can see, there was less loss in the crown here, more loss in kind of trying to bring the hairline down through those receded kind of upper temple areas. So we did put fewer graphs through the crown and focus more of the graphs in the front just because we had to drop that hairline down. But yeah, we did kind of address both areas.
right.
And this is Chrissy. So this is Chrissy from 2021. And can share maybe some of her experience. She already did, mostly, but anything else that you specifically want to mention about, you know, the timeline or the pain
Well,
level or the day of the surgery?
so a bunch of things. First of all, you guys were just great to work with. One of the things that you did that was probably really helpful was starting me on finasteride.
Yeah.
6 months before the procedure. And I think the target was 2,000 grafts, and I think there ended up being a little bit more than 2,000.
Yeah, you'd be
Can't hear.
I'll try to speak up. Can you hear me now, Bobby?
Okay, I've got my speakers all the way up.
Can you hear me now?
Yeah, a little bit. Yeah, pretty
Okay.
much.
So I'll speak louder and.
Yeah,
more
better.
clearly. Okay. So I had about 2,000 grafts, and they were able to cover, get the hairline down low or much lower, and also cover the crown. And the middle picture on the right was the day of the surgery. It was surprisingly less painful than I expected.
Mm.
The team at Solve Clinics was really very nice and easy to work with. They put me on finasteride about 6 months beforehand. I've never used minoxidil. And I don't want to use minoxidil. And I've had very good results. I mean, obviously you can see how long it is now. And I've had my hair cut every 3 or 4 months, starting about a year and a half ago. So it's grown in quite a bit. It took a while to cover and you can see it took a while to cover the crown. And, you know, one of the things that I realized right afterwards as it started growing with male pattern baldness is my hair is still not as thick on the top as it is on the sides. It'll never be that way.
Yeah.
But there's enough that I can do some pretty cool things with my hair. So-
And that is what I always kind of quote this stat because I think it's a good kind of illuminating fact is, you're born before you've ever thought about your hair thinning, when you're a kid, when you're a teenager, you have about 100,000 hairs from the hairline to the back of the crown up top. So, around the sides, it's about half of that. And as you get older, the hair naturally thins out. So, it is more about coverage than density, unless you have a lot of hair up there and we're just kind of adding density. You know, it is more about coverage and just kind of creating, you know, opportunities to style in certain ways to kind of disguise thinness.
Right, and it's hard to tell from that first picture before, which I think is on the right group pictures on the left one. But there was more issue with the crown that I was trying to comb it back to hide, would be one thing. And then two, you can see all the way on the left, where it says May 2021 before the procedure, how far my hairline really was starting to recede at that point in time. So a lot of reason for me doing this.
What are the top set of pictures you? Just those 6 ones?
Those are all me.
Oh,
So
all of these.
All 6 of them
Oh.
are Chrissy. The left 6 are just face, you know, not profile, just a face on picture, and then the top is displayed on the 6 pictures to the right side. So you just see the different stages in the timeline as they grow in. So I'll follow with my cursor here. So this was the day of the procedure in May. 4 months later, you can see, you know, the hair growing back in on the back and sides. Some discoloration, so pigmentation changes, very common. So in terms of the timeline for healing, we really talk about the first 6 months really being about healing. On the surface, yes, the scabbing takes about a week, but under the surface, it takes 4 to 6 months for everything to fully heal. You're going to have very thin, immature hair. You're going to see some inflammation that can sometimes show up in the form of pigmentation change, redness. That doesn't always happen. But after those first 6 months, then it kind of enters a growth and maturing phase. So the hair that is showing up is very thin and immature, but it thickens over time. And we have a couple of questions, so I'll stop talking for a moment.
Yeah, this one, baldness is not a problem in my family, hair loss is,
Can't hear.
it is thinner than it used to be when I was in high school. What is is there something that can be done?
Yes, and that's a good lead into the next,
Yep.
the next, yeah, so,
That's
you know,
perfect.
not everyone's a great candidate for a transplant.
Right.
You know, if they're not looking, yeah, it's all kind of native hair up there. And it's thick enough where, you know, if we tried to go through there and add, you know, more hair, we might damage the hair that's up there.
Okay.
So there are good ways we'll get into to kind of thicken what's up there as well.
Choose a question.
So I have another question. I'm on blood thinners. Would I bruise?
Yes, and actually for a transplant specifically, we do have people work with, whether it's whoever's prescribing the blood thinner. we
Yeah.
do, because it is so many little cuts into the tissue, we do try to work with whoever's providing that blood thinner to get you off 3 days before and 3 days after the transplant, if possible.
Yeah.
But do they do that?
I'm on blood thinners and that's what I did. I stopped 3 days before and 3 days after. And I had to provide a letter from my cardiologist
Yeah,
before they would do the work.
yeah. And just to be on the safe side, that's why we do that. But most cardiologists will not have a problem stopping for a few days before and a few days after.
I'm sorry.
Hmm.
Just like it back in real quick, just these 2 rows. Sorry, that's.
So yeah, that's a great question. Blood thinners, other, health risks, heart issues, if you have a cardiologist that you go to see. Full disclosure on that is definitely best. It is a surgical procedure still. It's very
Right.
superficial, so really involving mostly just the skin. But there
But for
can be.
blood thinners specifically, it is the scalp, which is very vascular, so there is a lot of bleeding involved with the
Yeah.
procedure. And there's very small little cuts, so it clots up, almost immediately. But if you were watching on yourself as we did it, most people would be pretty surprised.
Question over here.
One of the slides said that there were 1,100 transplants, and then the second slide showed 2,200 transplants.
Yeah.
Is that because, in answer to the first question, you sometimes have to do 2 procedures? The max is 1,100 transplants per procedure?
So usually we can do up to, and it depends on the person, but usually we can do up to 2,200 in
Mm.
one sitting. So that's kind of our maximum in a 1 day surgery. Now 2,200 grafts, what can that do? We do have some examples, but generally if people have loss, in the hairline and the crown, and, want to get as much hair as they can in both areas, we look at each person individually. So for some people, they can kind of split it between two different areas with one surgery. For other people, it's more, you need so much in the front. We need to do one surgery there and then come back, 3 months later and do another surgery
Mm.
crown.
That would assume that you have enough source materials to do that.
Absolutely, absolutely.
it's a-
And that's another factor that, we always take into consideration, because each hair that you take out from around the sides and the back, we're taking the stem cells that surround the hair, so it doesn't grow back around the sides and the back.
thinning
So we're kind of,
the host.
thinning out the supply to kind of spread it out up top. So
So there's a presumed, there's a presumed density then that you're aiming for. A
yes,
certain number of transplants per inch.
per square centimeter. Yeah,
Square
absolutely.
centimeter. I've never been metric, so too old to have learned it. Is there discretion within that, or is there a minimum and that's it?
No, so it really is kind of dependent on the person and really dependent on what each person wants, because there's a maximum density that you can achieve with a hair transplant. One of the big limitations is if you transplant 2 grafts and they're too close together,
Hmm.
they'll both compete over blood flow because they need to create blood flow. They'll compete over the blood flow and they'll both die. So there is kind of a maximum density with how close together you can pack these grafts.
How about the other way?
So
Where
the
you create
minimum,
more distance.
so minimum, there's no minimum. However, having said that, if you spread it too thin, like if you just did a very small number, for instance, 800 is a pretty small number, in terms 600, 800, something like that, and you spread it all the way from the hairline to the back of the crown, it would be spread so thin that it would look almost like nothing was done. So
Mm.
there is functionally, there actually is a minimum density where you don't want to go below because it'll just look kind of ridiculous. Or just like nothing was done. And then you spend all this money and, it looks like, nothing was really done.
Yeah, so over a decade ago, I saw Raymond Kinnear, who's a renowned hip transplant surgeon and plastic surgeon. He thought because I had generalized female type balding, although I have, I think, a more noticeable loss in the part and a little small circular part on the top, he thought I was not a good candidate, and I suspect it's because of the risk of shock loss of transplanted hair too close to existing hair.
Yes, and that is a risk with the procedure. One of the big issues with transplanting into areas where there is a lot of hair. So classically with female pattern loss, there's a lot of hair up top, but it's just kind of thinning diffusely up there. The problem with transplanting into that is there's something called shock loss, which is after a transplant, you've transplanted all these hairs up here. There's all this inflammation and swelling kind of going up to the area. And the native hair, not the grafts, but the native hair, the rest of your hair that's up there is so sensitive that it kind of shocks out. So it sheds. So you can lose a lot of native hair after a transplant. And it grows back in, but it could take, 6 months, 8 months, a year to grow back in. So it definitely.
Yeah. And there are 2 pieces to that. One is the shock loss, where it just causes hair in the area to shed, which does grow back. The other idea is that if you have a lot of native hair, it's living, but it's thin, right? If you try to wedge healthy transplanted hair between these living thinning hairs, you might end up damaging the ones that were already there.
Mhm.
And then you've killed 2 and replaced it with one
Right.
that might be slightly thicker. So that's kind of more to your point, that if it is a diffusion, that's the risk of the success of a transplant. And it's actually a very good lead into the preventative side, because a lot of times that is what our recommendation is for people that are in early stages of thinning, where a transplant might actually pose more risk for that very reason, causing more harm by killing living but thinning hair versus trying to treat that hair and thicken it up, you know, between different types of preventative options.
How much does this cost? What's a general estimate of what a cost of that would be?
So pretty much everywhere will charge per graft. So we charge $5 per graft. So some people, you know, might need just, you know, 1,000, 1,200 grafts kind of in the front third or front half of the hairline. So really it can range anywhere from, you know, $5,000 to $10,000 that people generally.
For a
spend
single procedure, and some people need more than one, as you suggested.
Joy, you know, I did it, so I had the question, I said, who's counting?
on.
And you know what? The answer is, they count. Right?
Yeah, we
Well,
count every single
we
one.
count for two reasons. One, because we have to look under the microscope to make sure that the
Each hair,
each
right?
hair is viable, but then we also have to count the number of, you know, incisions and holes that we make to then go back and fill in with the ones that we've pulled out. So it's kind of a double.
So if you were at 2,200, you'd be at $11,000.
Yeah. So it's not a cheap procedure. That is
Yeah.
for sure. Yeah.
Although when I did my research, you guys were pretty cost effective compared to some other places.
Yeah.
And the reviews were all 5 stars. And I would tell you, the care and the people there were just wonderful. And going into the next part, I've been continuously doing the next part as well.
Yeah.
And you can see where on the top, it took a while for some of that hair to come back, but that's what it looks like now.
Yeah.
Yeah.
And with every transplant, just based on how blood flow works and the scalp, the face, the head, on our face, it's kind of the most. So going into our forehead, that's where you have most blood flow, and you get less and less as you get further back. So when we're healing, the hairline typically heals more quickly than the crown does, just based on that blood flow distribution, the growth factors that the blood carries, the nutrients, the oxygen, those types of things. It heals a little more quickly. It's also getting into our next topic, which is preventative care. Chrissy mentioned going on finasteride, which is a medication we can talk about. Minoxidil is another well-documented hair loss preventative treatment option. It's the active ingredient in Rogaine. So Rogaine foams or oils that have been around a long time, but it's a blood pressure medication. So what it does is it dilates blood vessels and increases blood flow to the area that you apply it. So when you see Rogaine advertisements, they're not common anymore, but in the past, a lot of times they're always applying it to the crown area. And it is actually a treatment, minoxidil itself, that's more effective in the crown area than it is up in the front. And that's just because the front already has a little bit more blood flow. So as you get further back and there is less, the dilation of those blood vessels and increased blood flow actually has an increased benefit on those hairs. I would say, we're not necessarily tight on time ourselves. I know we were kind of supposed to go about an hour. If we're going to get into some of the other treatments, starting with preventative care, I think it's a good time to transition. We're happy to go back after and maybe answer a bunch of questions, but is everyone okay with that if we kind of continue moving forward?
Yeah, I think so.
So anytime we talk about a hair transplant, preventative care is going to be a part of that conversation. Because like we said, the transplanted hair typically is genetically different. It is resistant to what causes hair loss, but what is still affected is the native hair. So if you're receding in a certain area, if you're just generally diffused, that hair that you are transplanting to either connect to or transplanting in between to restore that density does need to be protected. It is at risk. So, you know, you could do a transplant tomorrow, have great results a year from now, but 5 years from now, going, you know, be back where you started almost with this diffused look. And kind of, you know, the question is what happened? The transplant wasn't successful. But the answer truly is that what you're still seeing then are the transplanted hairs that remained and your native hair did continue to thin or fall out. So the preventative side is always going to be very important. And for some people, it's really the only option. You know, a transplant might not be the appropriate route. So a lot of people, like we mentioned, where it's just a diffusion, preventative care really is the first place to start. It is progressive, it is degenerative. So the sooner that you start the preventative care, the better the potential results. Again, the hair follicles do die as a part of the thinning process. First, the hair follicle itself and the hair that grows start to thin. The follicle itself that's reflected in the hair then start to miniaturize. They don't grow as long as they used to. And as the hair follicle continues to shrink, it eventually dies as a part of, you know, the balding and the thinning and balding process. So intervention at some point earlier can reverse thinning hair to thicken up, miniaturizing follicles to elongate and grow a little bit longer. It may still be thin, but you know, the sooner that you intervene, the better. What does preventative care look like? Really, there's kind of multiple approaches that work in very different ways. We talked about Rogaine and minoxidil, the active ingredient that's a blood pressure medication. So there's kind of this class of preventative care that we kind of refer to as fertilizers. So by dilating the blood vessels, you're increasing blood flow, you're getting more oxygen, nutrients, growth factors to the hair. And as long as you can continue to dilate and continue to increase that blood flow, it effectively works like a fertilizer on the hair. Okay. A very similar treatment that maybe people have heard about are these laser hats or red light therapy. It works in a very similar way. The wavelength of the red light actually works to dilate blood vessels. So instead of doing it chemically with minoxidil that reacts and dilates blood flow, red light laser therapy works in the same way. Increases blood flow, works like a fertilizer, getting more, you know, what the hairs need to the area. PRP treatments are something that have been around for quite a while. It is another preventative treatment. It is injections, but the good thing about it is that it's a very natural treatment. It is a blood draw where a client might come in. It's about an hour-long appointment, but we do a blood draw. We spin in a centrifuge. That basically means taking your blood, spinning, you know, red blood cells, white blood cells, everything kind of separates by weight, and extracting and concentrating plasma. And then specifically within plasma, there are growth factors. This type of treatment isolates platelets. There's another version of PRP that is PRF, which is also platelets, but it's fibrin instead of plasma. So there's lots of different preventative options that basically get these growth factors, and these are basically through injections rather than just increasing blood flow. They're a little bit more direct in that sense. They take a concentration of what increased blood flow is trying to get to the area, and then it's injected back into the scalp to be absorbed and metabolized over time. The limitation with all of these treatments and all of preventative care is that they need living follicles to affect. So like I mentioned, someone who is shiny bald and all the hair follicles have died, it is really only a transplant that can bring either coverage or density back to those areas. But along the way, all of these different treatment and preventative options can intervene and help to reverse, rethicken, and even as preventative care. You know, some people have full heads of hair, you know, myself included. John's doing okay. But you know, a lot of these treatments do actually help your hair grow a little bit faster, grow a little bit healthier. So maybe affecting the dryness or brittleness. You know, if hair is breaking, it leads to the appearance, or if hair is shedding, it leads to the appearance of thinning. So a lot of them can actually not just help the hair follicle become healthier, but by elongating the life cycle and the shedding phase. You know, maybe if every hair sheds every 6 months rather than every 3 months, you have more hair growing at any given time. It all affects the appearance of density while also affecting the actual underlying health of the hair follicles themselves. These, yeah, go ahead.
If you're already using minoxidil, can you also do a treatment like PRP?
Yep, absolutely.
And they do work actually in slightly different ways where, you know, I always feel like it sounds like a sales pitch to people for hair treatments, but truly kind of the more angles you're attacking from really kind of the better the results, the more thickening you can get, dilating blood vessels to increase blood flow, kind of getting these growth factors around the hair. You're kind of coming from all these different angles. And that's really kind of where you get the most thickening. But absolutely, they work really well separately, but together there's kind of an additive effect between them.
Yeah, and Linda, this might be a good picture. It's basically just shows more classical female pattern loss, which can be a diffusion. It doesn't make sense, necessarily to try to do a transplant in here because while there's hair there, you'll probably end up damaging it if you try to wedge some thicker, healthier hairs that were taken from the back and sides. So really going the preventative route, it's not perfect, but it can, thicken and help restore, some of the density that maybe has been lost. With all of this class of basically fertilizers, as I described them, and really all preventative care, it does require maintenance. They basically work like fertilizer, so similar to a lawn, it does get absorbed and metabolized in the body and needs to be replenished. Otherwise, the environment kind of goes back to the way that it was before, less blood flow or fewer growth factors, those types of things that work as a boost for the hair.
Are these all contact where you gotta rub it all in?
It's different. It depends. The minoxidil can be an oil or a foam. So that would be daily application, a dropper and maybe massaging it in. The PRP, the PRF, as this is an example of, they are injections. There is a series that are done up front, but generally every 3 to maybe as far out as every 6 months is the long-term recommendation for those. So really less.
There's kind of a loading phase
Yeah.
to start where you do a series of 4 once a month to kind of really kind of get those growth factors into the tissue. And then maintenance, once you've done those first 4, then it's kind of every 3 to 6 months to kind of maintain the benefit.
I've been coming about 3 times a year now,
Yeah.
but it started monthly, that's been quarterly, and now it's like 3 times a year.
Yeah,
Yeah.
so you can kind of space it out and the longer you do it, the longer the body kind of lets these growth factors sit around the follicle of the hair without fully metabolizing them. So it's kind of training your body a little bit.
Will we have enough time to do the Botox and filler parts of this?
Yeah, I think
I
we
think
should jump into it really quick. It's almost 9 o'clock. I'm not sure how late your meeting goes. We're happy to continue with our presentation. I don't know
We
if you
can
do have
jump-
more of a cutoff or if you guys.
We don't
break
have
up.
a set time, it depends on whether people are engaged.
Yeah, we can kind of gloss over a couple things and
Oh,
then if
yeah.
there's any specific questions, we can answer questions.
Yeah, if anyone also has questions, reach out to our clinic. We do free consultations, so a lot of this is meant to be high level and informational. I know we're getting into very specific questions, which is great also because there's a lot of curiosity and there's a lot of information to share.
Do you have a card?
Yeah, I should have cards. We
Good.
can pass those out and we can both email this out or we can.
I forgot to bring.
We can provide something for you guys to be able to. So
So this is jumping into kind of what Kelly does, kind of on the injectable side, but this is a brand new treatment called Ativa
Just a thought.
Skin Tightening. So it's it was cycling through pictures, so you can kind of see different areas.
and I'll show them again. It's just a little distracting because it goes fast, but.
But basically the way it works is it's a cannula that gets stuck into the tissue.
A what?
A cannula, almost like a long needle kind of. And it's stuck into the tissue. So whether it's face or underarms, wherever it might be, it heats up the tissue. And causes kind of this intense kind of collagen formation in the tissue as it's healing.
That woman's the same person?
So yeah, those are, and
These are all before after. Some are
Yeah.
top bottom, some are left right.
So like with the face and under eyes is a very common place to get it done because you kind of can really tighten up that under eye skin. You can do it anywhere on the body, which is what's really cool about this. It's really kind of the way they, advertise it with their system is, when people do it on the face, it's literally to the level of like a facelift, but it's so non-invasive. It's still a needle going into your face, but it's, the downtime is just a day and then kind of back to normal.
How
But
long does it last?
so up to about 2 to 3 years. So it's not a cheap procedure, you know, a few $1,000s, depending on what area you do, but it does last for a few years. And it's really just using heat, kind of this radio frequency heat to heat up the tissue and cause this intense collagen formation, which then tightens the skin. So a lot of people do it, there's no pictures of it here, but a lot of people do it after they lose a lot of weight, and you get kind of that skin sagginess, kind of around the torso area. A lot of people do it for that as well. So it's actually a brand new treatment, but kind of an exciting one for us because there's not a lot like it out there without kind of doing, you know, pretty invasive and costly surgeries. So,
So
it is.
So it's a couple of $1,000s. Does that mean if there's a left eye and a right injection, it's $4,000?
No. So, you know, the under eyes, I believe is
I
2,000 or
think it's-
2,500,
Yeah.
but we do both eyes. We won't upsell you after we do one, so.
Basically, areas are anywhere, and it's mostly by size. It can be by complexity. I think the under eyes are 2,500. The neck is 2,000. And then it gets into maybe 3,000 to 4,000, depending on, you know, if it's arms, if it's, you know, stomach, if it's,
The volume.
it's
is-
volume.
Exactly.
Yeah, it's almost like volume, but it's basically by number of injections almost and surface area. So
And
time
it
of the
is-
appointment, those types of things.
Yeah, so it's an hour, about 2 hours it takes to kind of do the treatment. Yeah, depending
how
on the
much-
area,
depending on the areas.
an hour of that is just kind of numbing. You use a numbing cream to kind of numb up the area, and then an hour or so to
A
do the
lot
actual
of our treatments, you know, it might be an hour-long time slot, but there's also a lot of downtime. So even for like the hair preventative, if you're coming in for PRP or PRF, it starts with a blood draw, but it's about 25 minutes of downtime where you're just watching TV or people work or do whatever they need, where we're just spinning, separating, preparing. A lot of these other treatments also have numbing that's applied, not all of them, but that can take about 20, 25 minutes. So first coming in, starting with the numbing application and downtime, and then the treatment itself, you know, is performed afterwards.
But yeah, any other questions about Ativa? I know it's really what it is aimed at kind of tightening the skin. So anywhere you get kind of some sagging, just kind of the natural aging process, really those cannulas can be some, you know, anywhere.
Reduce wrinkles in the neck.
Yeah, and that's, you know, there's a great picture. I wish it was in that kind of cycle of pictures of a woman who did her neck and kind of lower face.
My wife has all kinds of wrinkles in her neck and she covers her neck up, so.
Yeah,
So
and
she
it's
might be
actually one of the
cheaper.
more popular spots,
Yeah,
actually, is the
yeah.
neck, yeah.
And then we'll move on. Do you want to, it's clicked on the search in the bottom left, so just people here can't see the full, this is actually the full picture.
Can we get
So-
rid of the search? Heather?
Other than that?
Do it.
Oh, it's clicked on here for the search, so it's blocking
Oh.
part of the screen. So if you just click anywhere at the top, really. Yeah, right there. I think that's there, perfect.
And yeah, the next two sections here are laser treatment. So there's two kind of different types of laser. The halo laser is aimed at kind of reducing any texture changes. So fine lines, wrinkles, acne scars, kind of bumps, things like that. So, you know, traditionally, you know, people always think of these lasers for the face, but again, they can be done kind of anywhere on the body. So with the halo laser, I always tell people with halo, think texture. So, you know, wrinkles is the most common thing. With the BBL laser, it's more for color changes like sunspots, age spots, things like that. The halo laser actually is kind of a full resurfacing of the skin. So it's kind of doing these almost, it's a laser, so just kind of swiped over the skin, but kind of resurfacing the skin. So these tiny little cuts. So you get kind of this little kind of polka dot, tiny little dots kind of all over the face if you do the face. And then it heals. This is kind of a great kind of progression of the healing here. And then that last picture compared to the initial one is about 6 to 8 weeks. Yeah, 6 to 8 weeks. So usually within a month to at the most 2 months, you are fully healed afterwards. By that kind of lower left picture, that's generally what people look like up to a week after the treatment. And then you get kind of an intense flaking of the skin. So you go through this kind of healing phase where there's kind of an intense shedding of skin, but then you've got kind of this, they call it the halo glow afterwards, where the skin is, you know, again, it's kind of banking on collagen formation. So damaging the skin to force the skin to kind of grow new skin and regenerate.
That's remarkable. What is that cost?
So the halo is, I believe, 1,600 per treatment.
And
And
this is one treatment we're seeing?
yes, yes. So it's generally done at once a year is kind of the recommendations for halo. Because those types of results tend to last, you know, 8 months to a year after you do it.
So they're not permanent.
They aren't permanent, but there isn't kind of maintenance with it. You don't have to come in every month for touch up, you know, lasers or anything.
Does it
like that.
regress all the way back to the way it was in a year?
No, it's usually kind of starts to regress a little bit. You know, you notice some wrinkles start to come back, and to kind of fully regress to where you were before would take usually a couple years.
Years.
Yeah.
You may never get back to where you were before. I mean, it really is just resurfacing. So it's new, it's generating new skin and new, and the collagen concentration and build up those types of things. But like all of the preventative treatments we described before, it does require maintenance just because then the environment does go back to the way that it was before. And, you know, just the general aging process kind of restarts without those additional, you know, that collagen manufacturing and growth factors basically being provided to the area.
What do you do for pain control with that?
So that one's numbing cream as well. It's with the numbing cream, we use kind of a very intense kind of prescription grade numbing cream that's
Okay, so it's just not 5% lidocaine.
no, this is lidocaine, benzocaine, tetracaine, kind of, they call it BLT cream and high percentages of all of them. So it works really well to kind of keep you comfortable while you're there. I'll tell you afterwards, it feels like you got the worst sunburn of your life. So it's a kind of intense for that first day afterwards, but not so much painful. It's just kind of a burning type sensation, which I guess could be painful. So the BBL laser is actually used for a couple different things. I said specifically it was used for color changes. So age spots, sunspots, things like that. Actually, even freckles. Some people don't like having freckles, and so they use it just to kind of get rid of
To
freckles.
soften them.
Yeah.
Yeah.
So it attacks pigment rather than the halo, which is attacking kind of these texture changes by attacking kind of the water in the skin. BBL can also be used. This is an example of someone who did it for acne. So it can be used for active acne. It can be used, I think that's an example
For discoloration.
for just kind of a
pigmentation.
melasma. Yeah,
Yeah.
just kind of color changes, slight color changes kind of throughout the tissue, but it can be used for hair removal as well.
Yeah, laser hair removal is the BBL as well. So, yeah,
So
there's
it-
kind of halo, that's all the texture things, the acne scarring, the deep wrinkles, the BBL, discolorations, acne it can benefit, or really laser hair removal are kind of its three applications. So different areas, it's not just the face, it could be the hands, it could be the neck or the chest. Some people do it on the back, you know, acne on the back, hair laser removal on the back, just freckles, those types of things. So really, you know, anywhere. Most people come in for face treatments. That's good, kind of, you know, what people mostly focus on themselves and what they have treated. But it does have a lot of
Do
applications.
they do it on arms?
Yeah, absolutely. That's a common one too.
So we'll get into injectables.
Yes, so most people have heard of Botox or other kind of toxins that are injected in. Really what they're doing is they are paralyzing the muscle. So, you know, this is a great example of someone who has kind of wrinkles in the forehead. The wrinkles are actually formed by muscle contraction. So it kind of over time causes these wrinkles in the skin. So by paralyzing the muscle, you're reducing the wrinkles. So very kind of classic example, forehead, A lot of people do it, they call it the 11 lines, kind of as you kind of frown down, kind of the vertical lines in between your eyes. Crow's feet, yeah, go
Hey,
ahead.
mention it. I've had it done many times. Forehead and 11.
Yep.
Three months ago.
Yeah, and that's exactly the time frame. Is kind of last 3 to 4 months. So it's another thing that's not permanent, but 3 to 4 months is.
And how often do you have it done?
Well, my plastic surgeon does it. He does micro Botox injections, Dr. Florentine in Down Row,
Yeah,
every 3 or 4 months. It depends. Years ago, it used to last longer. It doesn't last quite as long now, but
yeah,
it does a pretty good job.
yeah,
I mean,
Some people can't, the more you do it, you can develop not a tolerance, but almost a tolerance to it. So what
I
maybe
really
last
don't-
3 or 4
I-
months.
Right.
yeah. And a lot of people do that because it is kind of, sometimes you need a bigger dose,
Yeah.
I mean, we're talking over many, many years, but
Decades.
sometimes you do need kind of a bigger dose as you go
The
along.
Botox has gotten more expensive.
Yeah, it has. And actually, there's a few different types of toxins and they've all gotten more expensive, unfortunately.
Now, some people look at this picture and the next one and they ask, well, she's like raising her eyebrows. Like, obviously she has wrinkles in the first and she doesn't in the second. But it's actually the entire point of Botox is that it paralyzes the muscles. So these people actually just aren't able to really stretch those muscles and form the lines that they would otherwise.
But
So-
they're also a whole lot younger than most of us.
Yeah.
Yeah.
That can be a fair assessment as well.
Yeah.
It's actually shocking how young the community and the interest that we've already seen, get involved in it. A lot of people, even in their 20s, are starting to
Yeah.
Botox.
Yeah.
So that's.
But I mean, it's a treatment that does kind of span really kind of all ages,
Yeah.
it seems. It is interesting that there are people in their early 20s trying to get into doing Botox, but I would say generally it is a little bit older than that. So, but it does, I mean, you can do it at any age and, it works the same, kind of at any age. So, obviously kind of deeper wrinkles takes a little bit more in terms of dosage, but it is a very effective treatment for wrinkles specifically.
This kind of is a transitional side, but one other big use for Botox is actually in the masseters, which is the jaws. A lot of people, men and women, grind their teeth at night. And my wife actually receives Botox into her jaws specifically to help paralyze and decrease the activity of those muscles to help with nighttime grinding of your teeth and everything.
Does that hurt?
Sorry?
Bruxism.
Does that hurt?
Yeah.
Does the grinding hurt or does the
No,
Botox-
the grinding hurts because it gives you, I mean,
Yeah.
I
do
had
some, yeah.
jaw, what do you call it, from it, and I wear retainers now.
Yeah.
I
And it,
go ahead. No, you go ahead.
And that's actually a great way to deal with. My wife does the same thing, wears retainers for grinding,
Right.
but the Botox actually does a pretty decent job. It's kind of new. Actually, a lot of dentists have started injecting Botox in people for for grinding, and also there's something called TMJ. Yeah, and
That's it.
Uh,
Yeah, that's what I had.
Yeah, and that they've started using Botox. A lot of dentists will inject it now for that specifically.
A third application that's kind of tied to that is actually a lot of migraines. Some people get them injected.
Yeah, migraines.
Into different areas of the temples or kind of the forehead to address migraines, and it's actually been researched and documented to help decrease and help treat those.
And even just kind of shaping the face. So one thing Kelly was kind of showing me when she started was with both Botox and filler, which we'll briefly touch on as well, you can really kind of shape the face. So kind of classically, a male jawline is a little more squared off, where a feminine jawline is a little more rounded. So she was showing me kind of examples that she had of kind of rounding off jawlines to kind of feminize a look, or some men come in with kind of rounded jawlines who want to have a more square jawline. So generally if you're changing the shape of a jawline,
Yeah.
something like that. So That was a guy who just
You're
kind of
just
wanted
filling
to-
it out to, yeah, make it a little more square and full.
So Kelly's the expert on that in terms of kind of changing face shapes, but both with Botox and filler, and sometimes a combination of the two, you can kind of achieve, whatever kind of shape you're looking for in terms of kind of whether it's the jawline. Generally, it's kind of the jaw, the lower face does a lot in terms of kind of the overall look. Generally, people kind of from the nose up, that you can't change too much up there in terms of the shape, but on the jaw you can, because there's a
Yeah,
lot of
it's-
muscle, and a lot of fat pads there too. And then, lip filler as well, is a very popular treatment right now. So injections in the lip, I think some people, go a little overboard with it, and you can dissolve it with lip filler as well. So you can kind of tweak it a little bit. Some people are very conservative with it and then want to put a little, little by little go with it. Or some people, do too much, and, you can always dissolve it. Kelly tends to be pretty conservative with people and say it's a lot easier to go put more in rather than kind of dissolve what you put in. So, but there is really kind of an art to it as well. Speaking about filler specifically, there are a couple different types of filler. There's kind of these synthetic fillers, which are, injected in, and they just kind of sit there and your body metabolizes it over time. Newer types of filler, these dermal fillers, specifically Sculptra is one that we offer. It's kind of a filler that relies on your body. So it's injected in, and then over time, your body kind of builds collagen around what's injected in. So it's kind of a natural filler, so to speak, where it's not a synthetic filler that's injected into the tissue. So go ahead.
How long does that last?
So it can last really up to, generally, I would say about a year, sometimes a little bit longer than that.
Yeah, up to 2
I
years.
just had the cheeks done.
Did you do Sculptra? Was it?
Well, actually, I was gonna do Voluma,
Yeah.
but the doctor picked a different one. He said was much more dense.
Oh, interesting. Okay.
So he said up to 2 years,
Yeah.
and I saw the results right away. In about a week.
Yeah. And for, different types of fillers, some of them take a little bit longer to show up, but generally kind of, and especially the synthetic fillers, it's like, it's in there and it really kind of starts immediately.
You might see it the day of for certain types that, get your final results a week later. Sculptra, as an example, can take up to, I think 2 months really.
Yeah, the Sculptra specifically is kind of the all natural, option,
very
and it
slow.
does take your body time to kind of build the collagen.
And that's a lot of personal preference. Some people want the results tomorrow and to show it off, and other people don't want others to notice that something has been done. So much more progressional treatment might be, a preference. So it's kind of just, different what people want.
Cost?
So that's a great question.
Price sheets.
Yeah. I believe
It's actually all on our website as well. We're a little bit different in that we're pretty transparent about pricing, so it's all available online.
I believe
but yeah.
Sculptra it depends on how many vials you do. So most of these treatments or syringes specifically for Sculptra. I believe Sculptra is a few $100s per syringe.
200 or 300?
Don't quote me on it, but I believe it's something around that.
I thought it was $450. That's what, when you first ask, I think it's $450 a syringe, but also don't quote me. It's actually, Kelly would have loved being here.
Yeah.
This is like, she would have spent even more time than we did on the hair side, talking about each one of these individual offerings. And she's been doing all of these treatments. Some of them are newer than others, but has been in the space for over 7 years. So a lot of, experience and a lot of knowledge and enthusiasm and passion. So, but they are great questions. And the best answer for all of them is, what is it that you want to get done? Because then, like you see between the two of these 4 syringes or 5 syringes, it might be 1, it might be 5, and that's going to drive the cost. When it comes to filler, do you want it, what areas do you want it? If it's lasers, again, what areas are you looking at?
The other nice thing that I forgot to mention is if anyone is interested, we do virtual consults. So Kelly can you can send in pictures and say, this is the area that I want treated. And so you don't have to make a trip in just for a consultation, you know, if we're talking about going downtown or something like that. So there are options where it's a little bit easier.
Just as another.
Oh, yeah, and so very commonly, people are kind of looking, it's very popular right now, kind of for the under eye areas, so. Yeah, so, you know, Ativa is kind of a newer, the one we went over in terms of the skin tightening is very common. And then PRF is kind of similar to PRP. It's a blood draw that we centrifuge the blood. PRF specifically, when used as a filler, we heat it and cool it. So it kind of creates this gel-like substance of plasma and platelets from your own blood. And then it's injected into, you know, usually kind of small areas. So for this lady, she did it kind of right under her eyes. And then kind of those growth factors and platelets are kind of activated in the tissue and kind of just plump out the tissue a little
A
bit.
lot of people have a big focus on natural, you know, they don't want the fillers that, you know, are all the chemicals and stuff like that. PRF is basically the most natural that you can get. The PRP treatments are platelet-rich plasma, can be for hair restoration. It's actually also a part of like microneedling, the vampire facials. We do PRP or PRF as a topical application afterwards to basically get your body's growth factors into the wound to heal for that purpose also. But PRF, platelet-rich fibrin, is basically very similar, but it's heated and cooled like John just described to kind of form more of a gel that is a concentration of your body's natural growth factors regardless. So the most natural options are going to be those. Yeah, other than that, just a couple of treatments that we do offer. Microneedling facials I was just describing, that's the vampire facials. Basically thousands of micro cuts that activate your body's natural healing response and help, you know, rejuvenate the skin. Chemical peels are kind of what as they sound, you know, chemically treating your face to get your skin to basically shed, peel off, flake off over the course of about a week. And then new, you know, skin growing, you get that kind of glow. They talk about the halo glow. There's a chemical peel glow that takes, I think, about 2 months also as kind of the peak result for those, but progressive, you know, leading up to that. Weight loss as well. There's the big Mounjaro or Ozempic kind of, you know, fad. I don't know what you want to call it. But is something that we definitely work with people. We're less of like a factory about it. You definitely have to, you know, come in, get a consultation. We track weight loss with weekly check-ins, those types of things to be able to stay on it. You have to have lab work done and submitted, those types of things. So I think that it's something that's
Usually diabetes drugs,
Yes,
which people are using for weight loss.
yeah,
it's a repurposing.
It's repurposing. My wife has diabetes and I have diabetes kidney issues.
yeah.
So I went on a diet, special diet, kidney diet from, where was it? Michigan. It was diabetes diet from Michigan, University of Michigan. And Nikki, so we both went on the diet. And then Nikki's on Metformin,
Yep.
which is an old line product, been
Yeah.
around a long time. And we both lost over 50 pounds.
Wow.
Nikki
crazy.
and then I lost more from just helping in the diet. It's a protein diet,
Yeah,
where basically I'm not having carbs,
yeah,
and I'm not having I'm having basically vegetables,
Yeah.
and certain fruits, and mostly protein, like fish.
yeah.
I know, same from the red meat stuff. So
The diet and exercise portion is always essential. That there's no, you know, there's no pill, there's no injection, there's no, I mean, with it being a diabetes, you know, drug medication, really how it works with people without diabetes is it's kind of an appetite suppressor, is kind of the side effect, I would say. It affects insulin and, you know, blood sugar, you know, sugar and things like that as well. But, you know, to be healthy, you don't want to just lose 50 pounds in a week. You want to do it a little bit more naturally,
It was,
hopefully, but it
more than
depends.
6 months.
Yeah, exactly.
6, 8
Yeah.
months.
So that's the goal.
And that's generally where, when people do this, you know, Kelly tries to get people, you know, even with the.
Overnight, you're gonna gain it back right away.
That's also true.
Exactly,
You go
yeah.
off this and, you know, it's
You are.
very easy
Yeah.
to.
Yeah,
to
it's
go
the, it's
back
the
on.
lifestyle changes that you have to, there are the big
Yeah,
changes.
but the thing that started the whole thing is that I would diet and nothing would happen.
Yeah,
So
And-
you'd be dieting and dieting and dieting, they go like, well, why am I doing this? Cause it's not making any difference. I can just
Insulin
eat what I want then.
resistance is what you got.
And, but once
Yeah.
I went on the metformin, then when I dieted, it actually worked.
yeah, and sometimes that's just the like kick you need, you need to see an initial kind of response to be motivated even to kind of, you know, keep going with kind of the big changes.
I mean,
And I apologize, my computer lost internet for a second, but I've been kicked out of that Zoom meeting. It's at that was the last slide of the presentation before questions
okay,
and, but does anyone have questions going back all the way to the start? We're happy to, you know, answer or field any.
I do have a question.
Yeah.
Mark and John, can you tell us about your medical credentials training?
Yes, so I am a physician assistant. So I went to PA school in Arizona back in 2012, I guess it was. And then I started doing hair transplants in Chicago right after school. And I've been doing, you know, hair stuff ever since, really. We've kind of, you know, branched off into these other areas, but, you know, hair transplants, hair treatments was kind of my specialty and what I've kind of done since I graduated school.
Who was the physician who came to see me when I had my surgery?
Dr. Cashin,
Okay.
Stephen Cashin.
So yeah, Dr. Stephen Cashin he's
He's our medical director.
Yeah,
Yeah.
he's in internal medicine. He has his own actual internal medicine practice with some other partners actually down in the basement of the same building that we operate in Skokie. And then as well, you know, launched this business with us back in 2017, specifically getting into hair transplants, but everything obviously evolving from there. We have 3 other physician assistants, so 3 other PAs at the clinic, 2 of them specializing in hair loss and hair transplants. And then Kelly, who we mentioned earlier, that does all of the injectables, lasers, those types of things.
Mark, how about you?
Yeah, my background's on the business side. You know, our company starting, we kind of put all the pieces of this puzzle together that we had, you know, Dr. Cashin that years of medical experience in internal medicine, which is actually, it's less common in, you know, the cosmetic space. But for hair transplants especially is proving to be pretty beneficial. Just with general screening, you know, it's a very niche industry. And has grown from there, but we've gotten a different perspective than I think a lot of, you know, the cosmetic clinics and cosmetic doctors. That could be dermatologists sometimes, you know, they could be in
And Mark's standing in for Kelly, so it was
Yeah.
supposed to be one of our other PAs, but he's kind of
okay.
adopted the
Yeah. Kelly was supposed to be here. She would have been happy to talk about all the injectables and those treatments, but we had mentioned at the start, she did have an unexpected family commitment that came up that took her actually out all of today, which typically we're open in the office on Saturdays. But the office was closed and she isn't able to be here tonight. So I did kind of fill in. But yeah, my interest basically started with John, who after PA school, like he mentioned, started at Bosley for 2 years and over the course of those 2 years just kept saying we should start something. So I'm a CPA, which is a public accountant. I'm on the business side. I wear every single hat at work, which is, you know, the financial side, the accounting side, the HR side, the legal side, payroll, Operations,
Marketing.
reception. I'm one of our oldest receptionists.
Do you want some free legal advice?
Yeah.
Don't claim that you're giving legal advice to anybody.
That's
I've
probably
never-
good advice.
I'm never giving legal advice. I am our legal department in the sense that I do a lot of our own legal review and it's amateur.
Yeah, be careful. She's a lawyer.
Yeah,
She's a lawyer.
that was intentional.
No, that's fair. No legal advice given at all. I'll happily receive it, but I guess the advice is you shouldn't give it to me. I don't know.
We should have pre-warned you. She's a lawyer.
Yeah,
And
that's
I'm
fair.
an HR.
It's like-
It does help. My wife is in HR also, so actually she is my resource there, and I now have a lawyer resource. So this worked out. A legal read. So yeah, that's my background, which is definitely more on the business side, but doing sales and consultations, we don't even call it sales. We call our salespeople patient advocates. And at our clinic, we're really about education. That's really important to us, whether it starts with hair transplants that we got into initially or all of these treatments today. The way that we try to talk and we train our patient advocates is to be almost like this presentation today, so that people can make the best decisions for themselves, know what the options are. At our clinic, we're transparent about pricing. All those things kind of separate us from a lot of, I guess, our competitors. But yeah, I mean, we're happy to be here today, and thank you for some of those questions. Our backgrounds, we could have elaborated on at the start, I suppose, but it's good at the end as well. Full circle.
Well, thanks for giving up.
Thank you.
Yeah, any other
Yeah,
questions, anything
yeah.
before we kind of wrap up and let you guys, I don't know how your meeting goes from here, but.
There may be one or two people who might want to speak to you personally.
Yeah,
Yeah.
Don't forget the cards.
Yeah,
yeah, yes.
So I've heard that there's no issues that there's an up to 95% of survival of the hairs you transplant, or at least 90%. What's your experience?
Yeah, the technology's gotten so good where it is true that the survival rates of the grafts that are transplanted is 95% plus. So, that was a lot different even than when I started 10 years ago. So back then it was, 70-80%, was pretty dang good back then. So, but the technology, even though in the last 10 years has just progressed so much that 95% is legit.
Yeah, I would say you mentioned 90%. 90%, I mean, it's a success, but it's definitely below the margin that I think anyone in the industry aims for. I think 95 plus really is the goal and the standard.
And it's a hard thing to really track because,
Yeah.
it is, there's so much that can happen. There's some people who are not as careful as you two were after the transplant. They leave, they go home, they wash it, they forget, they aren't supposed to touch it for, as much as possible for the first week. So,
Yeah.
they don't use the sprays that we send people home with. So, there's a lot that can happen. So
Okay,
it's,
we got it.
it's,
There's definitely post-care instructions, and the first week is the most important, and that's really going to affect the survival and success. It depends where you go as well. The experience of the team is going to be very important also, but there is a lot of, take-home responsibility in that first week specifically.
Who's actually doing the transplants? Do you do them?
So I do them, and then we have two other PAs, Jill and Bianca, who have also been doing transplants for a lot of years. And then kind of a team of medical assistants. It's usually 3 to 4 people kind of in the room at the same time, kind of all in different parts of the procedure.
Yeah.
We're in a church, so you could ask God. You heard he knows every hair. What?
It doesn't work. God's not a genie.
I've learned that when I was a kid.
Can I get one of your
Yeah,
cards?
absolutely.
Well, thank
So
you.
I do have some cards.
Yeah, thank you.
Is anyone able to take a card to maybe take a picture of it even or send it out, or can we forward our contact information, our website, those types of things?
So
Do you
you
have
can
a-
take a picture and put it in this one.
Yeah, I could certainly scan it.
Well, it'll be in the newsletter, I would think.
And I know we sent some information about John and Kelly and maybe other information.
Yeah,
Is
you gave
that,
me some bio information.
is that a
Make sure-
newsletter that's coming out still, or has it already been sent out?
It's
that
already
people-
been sent out.
Okay, so some people maybe can review that for a little bit more background on our team. Kelly was supposed to be here. She's got a great bio. Hers is a little more thorough than John. He's a man of few words, I guess, but
Yeah,
Well,
that's-
these are
I'm gonna-
John
I'm gonna talk to
Delaney.
John today.
Yeah, absolutely.
Alice
absolutely.
said she's
I
gonna
think you
be,
folks are pretty easy to find on the web too, aren't you? I think
Yeah,
you're
yes.
solveclinics.com.
solveclinics.com, and I think someone had the website up a little earlier as a part of they
Yes, I did.
if you pull it up, actually, you can present and kind of show people if you don't mind. But solve like a solution, SOLVE, and clinics is plural. We do have 2 locations now, so we finally lived up to the name. But solveclinics.com. So, but yeah, otherwise, feel
Thank
free to
you.
follow
Yeah.
up with us. Consultations and information is always free, so we're happy to hear from anyone on any of the services that we talked about today, or, you know, anything else you might find on our website, which we do have a couple other offerings, but didn't touch on necessarily.
Thanks for coming.
Yeah,
Yeah,
thank you.
thank you so much
you.
for having us.
Thank you, thank you.